Health expenditure is expected to increase by 0.8% per year from 58.1 billion rand. This was in 2020-2021 to 59.4 billion rand in 2023-2024. Now, while some commitments, including the strengthening of the National Health Insurance Office and money being allocated to COVID-19 vaccine procurement are needed, the outlook for expenditure isn't too hopeful. For more on this, we're joined tonight by the Director of the Office of AIDS and TB Research at the South African Medical Research Council, Dr. Farid Abdullah, and human rights advocate Steve Litsike. My thanks to you both and welcome to the program. Dr. Abdullah, if I can begin with you, just how much, I wonder, has the past 2 years of the pandemic improved or merely exposed the weaknesses in what we already have known to be a fragile healthcare system in the public sector specifically?
Tembegile, I think you've hit the nail on the head. COVID has exposed the weaknesses of the system. We've had many wonderful stories and heroic responses to the COVID pandemic, and I don't want to take away from that. But the truth is that two things have happened in the health service. The numbers that you quoted of a 0.8% increase per year for the next 3 years, in real terms, that's actually a significant decline in budget for the health function over the next 3 years. I would go as far as saying it's the single biggest decline in the health allocation since 1994. So this is partly because we had to set aside funding for the COVID response, the 500 billion rand that had to be set aside. Most of that money came from the IMF and the World Bank, but a significant portion of it came from the different health departments, including the health department. So the net effect is that we are headed for trouble, but it's trouble at a particularly bad time. Mm-hmm. And that bad time is that after 2 years of COVID, we will need more money because there will be a rebound of the big epidemics of HIV, of TB, of cancer. All the people that have stayed away from the health services are going to start coming back. So I expect that the burden will increase, the budget will decrease, and that's heading for trouble.
How much would we need, I wonder, to fix our healthcare problem in this country? Is there a sum? Dr. Abdullah?
So there are different sums. The number that's been bandied about for a few years now is the additional 250 billion rand to implement national health insurance. I think that is fanciful thinking to think we could get so much money. What we need to do is at least to defend the budget that is available and then to use it smartly.
Steve, in the context of budget reprioritization during COVID and ever-shrinking budgets in South Africa and the rest of the world for healthcare, we talk a lot about healthcare in this country as a human rights issue, but do we treat it as such?
Look, I think South Africa has done significantly well in the past in terms of prioritization and aligning to, a section of our constitution, particularly sections 27, that really, enshrines the constitutional obligation and what we need to be doing. However, I think there has been many challenges in the past that still continue to crop our health system. You talk about these challenges, that range from human resource for health, supply chain management, medical product, equipment, machinery, infrastructure plans, but also the health service provision and also particularly around the stakeholders that revolves the health system, whether you're talking community engagement, the leadership and governance. And all of these things were discussed lengthily for the last couple of decades. We've been talking about this, including the recent Presidential Health Compact that identified and diagnosed what is happening within the health response. But now, in terms of whether we are able to match the action with resources, we are not able to do that. And I agree with Dr. Farid Abdullah when he say there are various numbers that reflects what kind of investment is required. Whether we can measure it's another thing, and which then speaks about whether can we achieve a universal health coverage for everybody, and also understanding that the health response in South Africa is two-tier. One is private, and the other one is public. And there has been inequalities that have been expressed overall, and why there's a need for NHI. It's something that we need to think through and how that is structured accordingly.
How implementable is the NHI at this stage, given our budgetary constraints then, Steve?
Look, I think the most important thing, we really need to bridge the gap, of the inequality that exists. There is no way where our health system, which is already overburdened, overstretched, as Dr. Abdullah had indicated, that we can only just assume a better health system that operates will only be in the private sector. And that also already identifies those who are privileged who can access quality health care. Already, if at all, we can implement NHI, we need to make sure that we match the budget to what needs to be implemented, but making sure that the health response can address even those who are in poorly conditions of setups, we address that. But even the infrastructure itself, you cannot expect only a functional, well-forced, well-maintained clinic will be in the urban area, whereas in the rural areas, you do not have that. Address maladministration, deal with incompetency, but also ensure that the health system is functional. I do think it's implementable if at all we've got the right affirmative services competency in place, and even dealing with consequences of maladministration.
Dr. Abdullah, what would be the cost for South Africa's poorest citizens if we're unable to get the NHI off the ground?
Well, we've kind of seen that to some extent, right? In provinces such as the Eastern Cape, Mpumalanga, many people with severe COVID disease never made it into the hospital. So as a result, 2/3 of all the people who died during the COVID epidemic died outside of the hospital. And, that is a serious measure of how our, of the weaknesses of our health system, of the lack of resources. We struggled with human resources, doctors, nurses. Even in the big cities, we struggled with the supply of oxygen, of ventilators. At the moment, there's very little quality health care for the poorest of the poor. And many of them, in addition to not having good access or good access to good health services, then were also terrified to go to the health services because of COVID. So many stayed at home, and that's why we have the situation where there are 2,000 cancer patients at Charlotte Maxeke Hospital who are not getting the treatment that they needed. There are 20% fewer visits to the HIV clinics in the last 2 years. And concerning for both Steve and myself, the amount of TB testing in the country over the last 2 years dropped by 50%. So there are a lot more people walking around with tuberculosis who are undiagnosed and untreated.
If I can, Doctor, just pick up on the point you're making about the cancer patients. Thousands, we're told, have been waiting in Gauteng alone to receive cancer treatment at public hospitals, i.e. Charlotte Maxeke Academic Hospital in particular. The oncology crisis of KZN was also a big issue a few years ago. Does South Africa have a largely ignored cancer treatment problem?
Cancer treatment is a real concern in this country, especially if you're poor and you don't have access to the private sector. In fact, whenever we want to show the inequality between public and private sectors, you just think about cancer treatment. In the private sector, you get a biopsy within days, you get surgery within a week or two, you get chemotherapy immediately. In the public sector, it's lacking on all those fronts. So that's a real marker for the inequality in this country. Someone who gets cancer and is poor, they're in big trouble. Their likelihood of survival, the prognosis is very poor. But having said that, I also think that one must compare ourselves to other countries of a similar economic status. and poorer countries. And I think we can do a lot more with the money we have. So in addition to the lack of resources, we also have just way too much inefficiency, poor organization. And, you saw the SIU report. We've lost so much money because of corrupt tenders and so much wastage that's going on. So those things also can be addressed. And there's a case to be made that we should all get together and fix those things before asking for more money.
Okay.
But I think you need both,
And I'd like Steve to come in here as we end off. Steve, we've been running a story tonight, and we'll repeat it later for our viewers who may have missed it, put together by Zikhona Chona Iranti, an organization that tonight has flagged concern about how LGBTQI plus people in this country are often not given a mention or not mentioned at all when we hear the State of the Nation address. And healthcare has been one of those spaces where queer people in this country have said there just isn't enough that speaks to their needs, not enough attention from the government. How does the president do that?
Look, I think there's a principle that the president needs to adopt when addressing the citizens of this country. A just approach will always be an approach that really addresses marginalized communities, vulnerable communities, and really uplift the needs of those who are left behind. There's no way we can actually move into universal health coverage, which really on its own requires capacitating the public health sector, without recognizing the human rights justice approach that we need to adopt. And even worse, addressing the injustice of the past. The queer community has been left behind in many ways more than ever. We've seen also and I'm really quite fortunate, we've had people like Dr. Farid and myself who had in the past led the development and the launch of the LGBTI HIV plan that significantly addressed the health needs. So if we have to do just and SONA and by the president, you have to really speak about how we eliminate homophobia, transphobia, how we ban conversion practices in the country, but also how do we ensure that those who are marginalized receive quality health care that is needed. And that is not a condition, that is not a special case, but is making sure that the sections in the Constitution that are enshrined are enjoyable by all.
Dr. Farid, one more question for you. I'm told we've got time for that. Let's talk about healthcare workers. They too have not been happy with how they are remunerated, with the conditions under which they're working. I mean, just this year, last year, in fact, we had healthcare workers at Charlotte Maxeke Academic Hospital writing a letter to the president. That's how unhappy they were. If the government is unable to get staff on board, how much of the battle to improve the healthcare system is lost on that basis?
Some people would say that if we just got the human resources right, if we were smart about planning, training, employing, deploying all the right healthcare workers in the right place, we would probably be the most important thing to get right. Every year, we find out that nurses can't be appointed, that community health workers are not getting paid their salaries, that the the doctors doing their community service and their internship don't have posts. I think that this is low-hanging fruit, and it just needs good organization, planning, careful planning, and carrying through the decisions and the policies that we already have in place. This is a logistical failure, and that's why we have such unhappiness. This would be an easy thing to fix, and fixing that would then also be the biggest impetus to improving healthcare. I think that's a good place to start.
Okay. Thank you very much to you both. That was Director of the Office of AIDS and TB Research at the South African Medical Research Council, Dr. Farid Abdullah, and Human Rights Advocate Steve Lidzike, speaking to us about healthcare expectations and the current state, especially of public healthcare in this country.